Are you living with kidney disease and unsure about what drinks are safe for you? We get it. Managing chronic kidney disease often means cutting back on a lot, especially when it comes to your diet. And let's be honest, it can feel like everything flavorful is off limits. Bland food, limited choices, and drinks? Even more confusing. But here's the good news. In today's video, we're revealing 6 of the best drinks for kidney patients. Delicious options that not only help you stay hydrated, but also support kidney function and improve overall health. Plus, we'll also share safe portion sizes, easy home prep tips, and what to look out for on product labels if you're buying from the store. So let's get started. Beginning with the very first drink on our list, blueberry juice. But what makes blueberries so special when it comes to supporting kidney function? Well, it all comes down to their powerful antioxidants. Chronic kidney disease is often worsened by oxidative stress and inflammation, which damage your kidneys over time, causing them to lose their ability to function properly. That's where blueberries come in. Packed with anthocyanins and flavonoids, 2 potent antioxidants, they help reduce inflammation and fight oxidative stress, protecting your kidneys from further harm. Pretty incredible, right? But that's not all. Blueberries also have a double benefit. They help manage 2 major risk factors for kidney disease: high blood sugar and high blood pressure. High blood sugar can damage the blood vessels in the kidneys, leading to a condition called diabetic nephropathy, which is one of the most common causes of kidney disease. Similarly, high blood pressure puts extra strain on the kidneys, making it harder for them to filter waste properly. Now, here's where blueberries come in. Their low glycemic index of 53 means they won't cause the sharp spikes in blood sugar that many other foods can trigger. This makes them a safe option for people managing diabetes, helping to keep blood sugar levels more stable. On top of that, blueberries have been shown to help lower blood pressure by improving blood vessel function, which is essential for reducing strain on the kidneys. So, whether you're concerned about blood sugar or blood pressure, incorporating blueberries into your routine can provide your kidneys with some much-needed support. Now, what about blueberry juice? Well, blueberry juice has all the same amazing benefits as fresh blueberries, loaded with antioxidants, helping reduce inflammation, manage blood sugar, and support kidney health. However, keep in mind that store-bought blueberry juices are often packed with added sugars, which can spike your blood sugar and are generally not ideal for kidney patients. So, instead of reaching for that store-bought bottle, why not make your own homemade blueberry juice? It's super easy and kidney-friendly. Simply take half a cup of fresh or frozen blueberries, blend them with about 1.5 cups of water, and blend until smooth. If you prefer a smoother texture, you can strain it, but I recommend keeping the pulp. It's full of fiber and other nutrients that make your juice even better for you. For a refreshing twist, add a little lemon juice or some crushed mint leaves. It's a delicious way to enjoy all the benefits of blueberries without worrying about added sugar. But if you're craving something a little creamier, you can turn your blueberries into a smoothie. Blend a 1/4 cup of frozen blueberries with 1 cup of rice milk. Rice milk is low in potassium and phosphorus, which are crucial to monitor if you have kidney disease, and it gives your smoothie a lovely, creamy texture. Now, here's an interesting tip. Frozen blueberries might actually be a better choice than fresh ones. Sounds surprising, right? But it's true. Fresh blueberries can have up to 52 pesticide residues, while frozen ones only have around 21. That makes frozen blueberries a cleaner and safer option. And here's the best part. Freezing them doesn't reduce their antioxidant power. In fact, frozen blueberries may retain even more antioxidants, B vitamins, and fiber than their fresh counterparts. So, if fresh blueberries aren't always in season or available, frozen ones are a fantastic alternative. Now, let's move on to something a bit different. Hydrangea tea. Yes, you heard that right. Hydrangea, the same beautiful flowering plant that might be in your garden, can actually help your kidneys in ways you might not expect. This isn't just another trendy herbal drink, it's a tea with real kidney benefits. So, what makes hydrangea tea so special? Let's break it down. First off, hydrangea tea contains chlorogenic acid, an antioxidant known for reducing inflammation and oxidative stress, two major contributors to the progression of kidney disease. So, this tea isn't just refreshing. It works hard to protect your kidneys by tackling these harmful processes from the inside. But wait, there's more. Hydrangea is also known for its ability to help dissolve kidney and bladder stones naturally. While research on humans is still limited, animal studies suggest that hydrangea root can reduce calcium deposits in the kidneys, potentially helping prevent the formation of stones. If kidney stones are a concern for you, hydrangea tea could be a natural way to help keep them at bay. And that's not all. Hydrangea tea also acts as a natural diuretic, further supporting your kidneys in their crucial role. Now, you might be wondering, what exactly is a diuretic? A diuretic is something that helps your body get rid of excess water and waste. It increases urine production, flushing out toxins like urea and creatinine, waste products your kidneys typically filter. By helping your kidneys work more efficiently, hydrangea tea also aids in preventing kidney stones by reducing the buildup of waste in your system. You might ask, how strong is hydrangea as a diuretic? Don't worry, it's not as harsh as prescription diuretics. Hydrangea tea has a moderate diuretic effect, meaning it works effectively but gently, without overwhelming your body. However, if you're taking medications for blood pressure, fluid retention, or if you've been advised to limit your fluid intake, it's best to drink hydrangea tea a few hours apart from your medicines. This will help you avoid any potential interactions. Now, when it comes to buying hydrangea tea, it's available in both dried root and powdered form. Be sure to look for 100% pure hydrangea root with no fillers, preservatives, or artificial flavors. Organic options are ideal because they're free from pesticides and contaminants. Now, let's talk about how to make hydrangea tea for maximum efficacy and safety. Start with 1 to 2 teaspoons of dried hydrangea root per cup of water. If you're using the powdered form, use only 1 teaspoon, since it's more concentrated. Boil a cup of water and pour it over the hydrangea root in your cup or teapot. Let it steep for 10 to 15 minutes. Longer steeping will give you a stronger flavor. Strain out the root before drinking. The tea has an earthy, slightly bitter taste, but you can easily enhance the flavor by adding a teaspoon of honey or a squeeze of lemon. If you prefer a milder taste, simply steep it for a shorter time, or dilute it with more hot water. As for how much is safe to drink, it's best to limit yourself to no more than 2 teaspoons of dried hydrangea root or 1 teaspoon of powdered tea per day. Overconsumption can cause nausea, dizziness, stomach irritation, and even a tight feeling in the chest. So, start with a small amount, see how your body reacts, and don't overdo it. And, of course, if you have an existing kidney condition or are on medications, be sure to consult your doctor before making it a regular part of your routine. Now, let's dive into something golden and incredibly beneficial: turmeric milk. You might be wondering, why not turmeric tea? Well, I could recommend turmeric tea, but for a very special reason. I'm going to tell you about turmeric milk instead. Stick with me, and I'll explain why in just a moment. First, let's explore why turmeric is such a powerhouse. Turmeric is packed with a powerful antioxidant called curcumin. This antioxidant does a lot more than just give your food that beautiful golden color. One of its standout benefits is its ability to help lower bad cholesterol or low-density lipoprotein and regulate blood pressure, two major risk factors for kidney disease. But that's not all. Curcumin also plays a key role in regulating blood sugar levels, which helps prevent kidney disease progression caused by high blood sugar. Since diabetes is one of the leading causes of kidney failure, this benefit is especially important. Now, let's talk about kidney function. Studies suggest that curcumin can help prevent protein loss in urine and lower levels of urea and creatinine, waste products your kidneys normally filter out. By reducing inflammation and oxidative stress in the kidneys, curcumin can help preserve kidney function over time. How amazing is that? But here's the catch. To get the full benefits of turmeric, it's important to use the right kind of turmeric powder. When buying it, always look for organic, non-irradiated turmeric with a high curcumin content. Aim for at least 3% or higher. Some turmeric powders may be mixed with fillers or artificial colors, so be sure to check the ingredient list before you buy. Now you might be thinking, what about fresh turmeric root? Fresh root is the purest form of turmeric, and if you don't mind the extra effort of peeling, grating, and grinding, it's a great option. But there's an important consideration. Turmeric is high in oxalates. Oxalates can contribute to the formation of calcium oxalate kidney stones, which can be harmful to your kidney health. And that's exactly why we're choosing turmeric milk instead of turmeric tea. So, what exactly are calcium oxalate stones, and how do they form? These stones develop when oxalates in your diet bind with calcium in your kidneys, creating sharp, crystal-like deposits. The best way to prevent them is to ensure you're getting enough calcium in your diet, especially when consuming high oxalate foods. That's where turmeric milk comes in. It's a safer option. When making turmeric milk, we use only half to 1 teaspoon of turmeric powder, a manageable amount that won't overwhelm your kidneys with too many oxalates. Now, let's talk about the best milk to pair with your turmeric. Dairy milk is high in phosphorus, which isn't ideal for those with chronic kidney disease. Nut milks, while popular, tend to be high in potassium, phosphorus, and oxalates, which we want to avoid. The best choice is rice milk. It's low in both potassium and phosphorus, and provides calcium to help neutralize the oxalates in turmeric. So, how do you make this kidney-friendly turmeric milk? It's simple. Warm 1 cup of rice milk on low heat, then stir in half to 1 teaspoon of turmeric powder. To boost curcumin absorption, add a pinch of black pepper. This can increase curcumin's effectiveness by up to 2,000%. Let the mixture heat gently for a few minutes, stirring occasionally. If you'd like, you can also add a touch of honey for sweetness. Now, how much turmeric milk can kidney patients drink daily? 1 cup per day is generally safe, as long as you don't exceed 1 teaspoon of turmeric powder. However, if you're new to turmeric, it's best to start with a smaller amount and see how your body responds. Finally, let's talk about medication interactions. Turmeric can thin the blood, so if you're taking blood thinners like warfarin or aspirin, you should avoid consuming large amounts of turmeric milk. It may also interact with antibiotics, antidepressants, chemotherapy drugs, antihistamines, and diabetes medications. To minimize potential interactions, drink your turmeric milk at least 2 to 3 hours apart from your medications. And if you're on multiple medications, it's always a good idea to check with your doctor before making turmeric a regular part of your routine. Moving forward, let's talk about something that might surprise you with how much it can actually benefit your kidneys. Lemon water. You might be thinking, it's just a simple drink, right? But believe me, it's far more than that. Lemon water is packed with benefits that go beyond basic hydration. In fact, it can be one of the most effective and natural ways to support your kidney health. So, let's dive into why. First off, lemon water works as a powerful detoxifier. It's not just about quenching your thirst. It helps your body flush out harmful fats. These include fat around your liver, abdomen, and even in your arteries. When you drink lemon water regularly, you're helping your body clear out unhealthy fats that could lead to high blood pressure and blood sugar spikes, 2 major contributors to kidney problems. But here's the key benefit: the citrate in lemons. Citrate is especially effective at preventing kidney stones, particularly the most common type, calcium oxalate stones. How? It prevents calcium from crystallizing, which is how kidney stones form in the first place. In fact, some believe it can even help dissolve small stones before they have a chance to grow larger. That's pretty incredible when it comes to protecting your kidneys. But wait, there's more to it. Lemon water also works to prevent uric acid stones, which are the second most common type. These stones develop when urine becomes too acidic. Now, even though lemon juice is acidic, it actually has an alkalizing effect on the body once digested. This helps neutralize excess acid in the urine, reducing the chances of uric acid stones forming. Moreover, If you're concerned about potassium, especially if you have kidney issues, there's no need to worry. A glass of lemon water made with just half a lemon contains about 60 milligrams of potassium. That's a very small amount and is perfectly safe for most people, including those with potassium restrictions. But there are a couple of things to keep in mind. The main issue with lemon water is its acidity. While it's super beneficial, frequent exposure can erode your tooth enamel over time. But don't worry, this is easy to prevent. Just use a straw to minimize contact with your teeth. You can also rinse your mouth with plain water afterward, or hold off on brushing your teeth for about 30 minutes. And, for anyone dealing with acid reflux or digestive concerns, there's a small caution. Lemon water can sometimes aggravate these conditions. If that's you, no need to skip it altogether. Just dilute it with a bit more water, or drink it with food, rather than on an empty stomach. Now, let's take your lemon water to the next level. By adding a few simple ingredients, you can boost both its flavor and its health benefits, making it an even more powerful ally for your kidneys. Start with fresh mint leaves. They not only add a refreshing twist to your drink, but they also bring digestive benefits that help soothe your stomach. Mint can also help reduce bloating, making it a great addition if you're looking for a bit of relief. Next, toss in a few slices of cucumber. Not only does it enhance hydration, but it adds a mild cooling effect that makes your lemon water even more refreshing, especially on a hot day. Cucumber is also known for its anti-inflammatory properties, which can support overall kidney health. And if you want to give your drink an extra health boost, grate a small amount of ginger into the mix. Ginger is packed with anti-inflammatory and antioxidant properties, and it's great for regulating blood sugar levels. Plus, it adds a warm, zesty kick to your lemon water, turning it into a deliciously unique drink. With these simple additions, your lemon water goes from just a thirst quencher to a powerhouse drink that detoxifies your body, supports kidney function, and helps manage your blood sugar and blood pressure. It's an easy, refreshing way to keep your kidneys healthy and your body feeling great. Now, let's move on to number 5 on our list. Apple juice. You might be thinking, apple juice? Isn't that high in potassium and sugar? Well, yes. A typical cup of unsweetened apple juice does contain about 250 milligrams of potassium and 24 grams of natural sugars. But don't worry, I've got a recipe that's a bit more kidney-friendly and diabetic-friendly, so you can still enjoy the benefits of apple juice without all the concern. First, let's explore why apple juice is so great for your kidneys. Apples are packed with quercetin, a powerful antioxidant known for its anti-inflammatory properties. This means that apple juice can help slow down the progression of kidney disease by reducing oxidative stress, which is a key player in kidney damage. Quercetin also helps lower high blood pressure and improves circulation, both of which are major risk factors for kidney patients. But the real game changer? Studies show that quercetin can help prevent the loss of kidney function by reducing fibrosis, which is the scarring and damage of kidney tissues that worsens chronic kidney disease over time. Amazing, right? Now let's talk about the recipe. Typically, to make 1 cup of pure apple juice, you'll need 2 medium apples. This gives you about 250 milligrams of potassium and 24 grams of natural sugars. While this might be fine for some, if you're diabetic or need to watch your potassium intake, there's a better way to enjoy apple juice without the worry. The key is to juice the apple with the pulp. Why? By keeping the pulp, you retain more fiber, which helps slow down sugar absorption, making it safer for those with diabetes. Fiber also plays an important role in preventing excess phosphorus from entering the bloodstream and stressing your kidneys. Plus, juicing with the pulp reduces the glycemic index of the juice, so it won't cause those rapid blood sugar spikes. Here's the recipe. Start with 1½ medium apples, ideally red varieties like Fuji or Gala, which are naturally sweeter and don't require added sugar. Juice the apples along with the pulp, which helps maintain the fiber content. This method will give you a glass of juice that contains around 200 milligrams of potassium and less than 20 grams of sugar, which is much more kidney-friendly than regular apple juice. To make the juice even smoother and less concentrated, you can dilute it with water, cutting both the potassium and sugar content in half. This way, you can enjoy the juice twice a day without worrying about excess sugar or potassium intake. If you're concerned about pesticide residues, since apples can be heavily sprayed, soak your apples in a baking soda solution of around 1 teaspoon of baking soda per 2 cups of water for about 15 minutes before juicing. Alternatively, peeling the apples can help reduce pesticide exposure, though it removes some of the fiber. So there you have it. With this simple adjustment, you can enjoy a refreshing, kidney-supporting apple juice that's lower in sugar and potassium, but still packed with the health benefits of apples. And finally, let's talk about number 6, unsweetened green tea. If you're a kidney patient, or just looking for a healthier alternative to coffee or black tea, green tea might be just what you need. But what makes it stand out? The answer is catechins. These powerful antioxidants in green tea are known to reduce inflammation and oxidative stress, 2 major contributors to kidney damage. In fact, studies have shown that catechins can help protect the glomeruli in the kidneys, the tiny filters responsible for removing waste like urea and creatinine from the blood. But that's not all. Green tea does wonders for regulating blood pressure as well. It helps relax blood vessels, improves circulation, and can reduce the risk of hypertension, a major risk factor for chronic kidney disease. And when it comes to blood sugar control, green tea is incredibly helpful. It boosts insulin sensitivity, which helps prevent dangerous blood sugar spikes and crashes that could potentially damage your kidneys over time. Now, while making green tea is simple, let's talk about how you can elevate its taste and benefits. A squeeze of lemon juice not only adds a refreshing zing, but also boosts the absorption of catechins. You can also steep a few fresh mint leaves in your tea, which adds a cooling effect and supports digestion. For a touch of warmth and natural sweetness, try adding a small piece of cinnamon. These natural additions can make your green tea even more enjoyable and health-boosting. Now, one thing to keep in mind with green tea is its mild diuretic effect due to the caffeine content. While caffeine can increase urination, the amount in green tea is much lower than in coffee or black tea. A typical cup of green tea contains about 30 to 50 milligrams of caffeine, compared to 50 to 90 milligrams in black tea and up to 200 milligrams in a cup of coffee. This makes green tea a gentler option, especially for kidney patients who need to be mindful of their fluid intake. However, if you are in the later stages of chronic kidney disease, such as stage 4 or 5, your doctor may advise you to limit fluid intake, in which case green tea may not be suitable. For most kidney patients, though, 1 to 2 cups per day is generally safe and beneficial. As for the best time to enjoy your green tea, it's ideal to drink it about 30 to 40 minutes before or after meals. Drinking it right before or after meals could interfere with iron absorption, which is particularly important for kidney patients who may be dealing with anemia. Additionally, it's best to avoid drinking green tea before bed, as the caffeine could affect your sleep. So, go ahead and sip on some unsweetened green tea for a refreshing, kidney-friendly beverage that not only supports your kidneys, but also helps regulate blood pressure and blood sugar levels. And there you have it, top 6 best drinks for kidney patients. But that's not all. Remember, kidney health is closely linked to diabetes. Managing blood sugar levels plays a huge role in protecting your kidneys from long-term damage. For more tips on maintaining kidney function and better diabetes management, be sure to check out our other channel, Health for Diabetics.